Hi, I'm Richard Goodfellow, Program Chair of the Canadian Chapter of the American Academy of Craniofacial Pain. This is our 6th annual symposium. We started the Canadian chapter of the AACP to educate the Canadian dentists and other health professionals with evidence-based material on how to diagnose, treat, and manage TMJ disorders, craniofacial pain, and sleep disorder breathing. It was very important for us to tell a story, to build on the previous year's information and carry on from there. So each year we invited experts from around the globe to share their knowledge with us. Okay, so now it's year number 6, and this is very exciting. So this is what we're doing this year. We've asked Barry Cecil to return with some of his research team to explain to us what is new in orofacial pain pathways and their clinical implications. How does it affect you in the office? We've asked Dr. Barry Glassman to return to share with us what he's learned in the last 5 years, and we've asked him to come back to talk to us. Barry is on staff at 3 different hospitals in Pennsylvania where he treats craniomandibular dysfunctions and sleep disorders. He's going to talk to us about bruxism and chronic pain as a trigeminally mediated disorder. Wait a second. Pain, trigeminal, nerve, bruxism, we're seeing a trend here. We've asked Jerry Smith to talk to us on the missing links in acute and chronic head and neck pain. Dr. Jerry Smith is the originator of the occlusal cranial balancing technique, with the world's first occlusal system to balance cranial bone and spinal alignment. Chronic pain affects everything. You need to put it all together. Dr. Smith's 42 years of clinical research has uncovered several of the major missing links for the cause of chronic pain. Let's see what he has to say. We've got Dr. Derek Nordstrom coming. Some 30 years ago, Derek began working in teams of osteopathic physicians. With this synergy, he's designed a dental orthopedic appliance to specifically address the unique craniofunctional, neurological, and micrometabolic needs of each patient, with results that have not been duplicated by any other technique. And definitely not least, we have Dr. Indra Narang coming. Dr. Narang is the Director of Sleep Medicine at the Sick Kids Hospital and an Assistant Professor in Pediatrics at the University of Toronto. Her current clinical research interests include sleep apnea in high-risk patients, the effect of sleep apnea and cardiovascular risk in obese children, the role of medication in regulation of breathing and sleep. So you can see what we're doing. We're bringing together professionals from all over the place to connect, explain, and share their knowledge and tell their story. You need to know that placing restorations can alter jaw position. Changing jaw position changes the forces on the cranium and the spine. You need to know that moving teeth affects the jaw, affects the spine, affects the cranium, and affects the airway. You need to know that affecting the airway affects sleep, and affecting sleep affects everything. We're no longer guessing at this stuff. We're changing people's lives and making them better. Come and learn. You're invited to come to the 6th annual symposium in Toronto. Look us up. We'll give you the website, we'll give you the phone number, and we invite you to come.